So let's talk a little bit about your background and training when it comes to dental implants. I mean, you placed, I guess, well over 20,000 dental implants.
Well, I've been in practice for over 28 years, and I got into dental implants right after I had gotten out of dental school, and I had gotten involved in dental implants by going into an implant residency or fellowship program, which at that particular time there were only 2 in the country.
Okay.
Right? One was at Brookdale Hospital, which was the very first implant program in the country, and that's the one I had gone to, and I was taught under Dr. Norman Cranen, who was a pioneer in the field of implant
So
dentistry.
every week, every day, you do dental implants?
Every week,
I mean,
every
this
day.
is what you've restricted your practice to?
Ever since I've been in practice, this has been my focus.
Okay.
Just dental implants and dental implant reconstruction. I lecture on the subject. I
mean, all over the world,
all
right?
over the
Out of the
world.
country you lecture.
all over, everywhere from India to the Middle East, multiple countries in the Middle East, India, Europe, Mexico, Canada. It's taken me all over the world.
You teach at the university. Tell me about that.
I teach at the University of Tennessee in the Department of Graduate Periodontics, and so I have the opportunity of working with the young periodontists who are going through the program. And what I specifically teach is implant and implant-related procedures.
You're a researcher as well. I mean, you're really into this. You
I've-
publish articles?
Yes, I have multiple publications. What most people don't realize is that I had developed several implant designs. I had done.
You have patents on some of these?
I do.
Is that right?
I have surgical patents on various techniques that are used right now, like the non-functional immediate provisional. I was awarded the patent back in 2002. I had started that particular research in 1992, and so it took about 10 years of going back and forth and everything, but I was finally awarded that particular patent, which is used all over the world today.
It doesn't cost more to go to an expert, does it?
No, absolutely not. Absolutely not. As a matter of fact, if you don't go to an expert, it probably costs you more.
Why do you say that?
Well, because sometimes maybe some of the results may not be as desirable as what
They end up in your lap sometimes?
they end up in my lab quite a few times.
So what should somebody look for then in an implant dentist?
Well, I think what they need to look for in any practitioner, especially in implant dentistry, is the a practitioner's experience, experience level.
Okay.
And it's incumbent upon the patients to ask those questions. What the practitioner's experience is, how many they have done, what their background is, okay? Because really the truth is, just because someone is a specialist in a recognized specialty, that gives no indication to their level of knowledge, skill, or expertise in the field of implant dentistry.
So if somebody wants to know more,
I invite them to come in, because then we can go ahead and discuss their options.